Hello, dear followers. How are you doing today? I hope you are doing well. Welcome to another question of dermatology. A 25-year-old man presents with bloating and alteration in his bowel habit. He has been keeping a food diary and feels his symptoms may be secondary to a food allergy. Blood tests show a normal full blood count, ESR, and thyroid function tests. Anti-endometrial antibodies are negative. What is the most suitable test to investigate a possible food allergy? A. Total immunoglobulin E levels. B. Hair analysis. C. Skin patch testing. D. Skin prick tests. And E. Jejunal biopsy. Okay, this question is asking about the most suitable test to investigate a possible food allergy, and the most suitable test for investigating the food allergy is skin prick test. Here we are going to explain about the different types of allergy tests. Okay, as we said, the answer is skin prick test, and we are going to explain it. Skin prick testing would be the first line approach here, as it is inexpensive and allows for the investigation of a large number of allergens. Whilst there is a role for immunoglobulin E testing in food allergy, it is in the form of specific immunoglobulin E antibodies rather than total immunoglobulin E levels. Okay, allergy tests. Skin prick test. Most commonly used test as easy to perform and inexpensive. Skin prick test is the most commonly used test because it's easy to perform and is inexpensive. Drops of diluted allergen are placed on the skin, after which the skin is pierced using a needle. A large number of allergens can be tested in one session. Okay, normally in class a histamine as a positive and sterile water as a negative control. A well will typically develop if a patient has an allergy and can be interpreted after 15 minutes, and this short times is also important. We can do the skin prick test in the same session, and we can see the result after 15 minutes. Skin prick test is useful for food allergies and also pollen. Okay, this was about skin prick test, and here we are going to read about radioallergosorbent test or RAS. Okay, radioallergosorbent test or RAS determines the amount of immunoglobulin E that reacts specifically with suspected or known allergens. For example, immunoglobulin E to egg protein. Results are given in grades from 0 as a negative result or 6 as a strongly positive. 0, 1, 2, 3, 4, 5, 6, and 0 is negative and 6 is strongly positive. Radioallergosorbent test is useful for food allergies, inhaled allergens, example pollen and wasp or bee venom. Okay, blood tests may be used when skin prick tests are not suitable. For example, if there is extensive eczema or if the patient is taking antihistamines. Okay, in the situation which the skin prick test is impossible for the patient, then we can use radioallergosorbent test. In the situation as when the patient has extensive eczema or the patient is taking antihistamines, instead of skin prick test, we can do radioallergosorbent test for evaluating the patient's food allergy or allergy to pollen, wasp or bee venom. Okay, skin patch testing. Skin patch testing is useful for contact dermatitis. Around 30 to 40 allergens are placed on the back. Irritants may also be tested for, and the patches are removed 48 hours later with the results being read by a dermatologist after a 48 hours. Okay, and here was an explanation about the different types of allergy tests. Thank you for your attention.